if we talk about a single intervention which can change the outlook of the whole journey of this infancy, that is the breastfeeding. Protein content is something which improves the quality of the breast milk. And in Indian women, we do see, because we are vegetarians also, the protein content of the human milk, it's not so great. The hypothyroidism, in which the thyroid hormone is deficient, this is the one of the very important cause of mental retardation. Yellowishness or jaundice is something which happens in majority of the babies, 70 to 80% of the baby. But that doesn't translate that all these babies will need treatment. Only 15 to 20% of these babies will need treatment. Less than 2 years, the baby should not be exposed to any of the screen time. Vaccines are for preventing the illness. So they are so that when the baby is exposed to that bacteria or that virus, he or she already have sufficient antibodies that he can fight with that exposure of that bacteria or virus.
Welcome viewers and listeners. I'm your host, Dr. Prashant Nag, pathologist by qualification, Vice President Diagnostics. Today's episode is about the joyous journey of newborn entering into your life. Hello, Dr. Naveen. Welcome to our new podcast where we'll be talking with Dr. Naveen about neonatal and infant care. Dr. Naveen is a pediatrician who has specialized in neonatology from Sir Gangaram Hospital and has a varied experience across globe. And we'll be taking your help to take our viewers and listeners about how to go about in that journey of joy where there's so much, at times you get anxious, what is right, what is wrong. So a very warm welcome to Dr. Naveen. So to start with, let's define for our viewers, when we say neonate, neonate is a child who is below 28 days of the age, and an infant is the one below 1 year of age. So before starting, we'd like to have a single line advice to all would-be parents to start this podcast.
Yeah, so it's really a moment of joy when a newborn is coming to the family and when a new member is being added to the family. So the parents, they are anxious that how the things will be. So if I have to give a single line of advice to the parents who are going to would be father and would be mother, that for the first 1 month, there are 3 things which they should take care of. One is that they should take care of the feeding part, they should keep the baby warm, and they should ensure that the baby is peeing well. Peeing well means the baby is peeing around 5 to 6 times in 24 hours. So these are the 3 cornerstone advices, and they should always remember that the care, it's more of a discipline thing, and they should observe the thing, because the newborn, he can't speak or he can't tell if he is having some problems.
Very summarized in such a lucid manner. What matters is observation, what matters is timely feeding, not to get worried easily, but you should be cautious. Just let's start it from the time when newborn enters the world with that cry, which is a bundle of joy for everyone. So what is the delivery room care? What are the primary thing which you feel parents should be advised antenatally? Let's start with that.
So I think with so many advertisement, now the people are very much aware that if we talk about a single intervention which can change the outlook of the whole journey of this infancy, that is the breastfeeding. So if in the antenatal visit, the mother should be told about the importance of the breastfeeding by the obstetrician, so that she is prepared that right from the word go, right from the moment the baby comes in the life, she has to put the baby onto the breast. In the delivery room, when the baby comes, there are few things which have changed over the recent years, like we don't need to cut the umbilical cord immediately, and we don't need to separate the baby from the mother. Let the delivery happens on the mother abdomen only, and then the baby crawls and the baby reaches the breast, where the baby should be offered the first feed, and baby should be left with the mother, provided the baby is healthy and the baby is crying. So this mother to baby bonding and initiation of the breastfeeding within the first hour of life, there is enough data to suggest that it leads to successful establishment of exclusive breastfeeding for the first 6 months of life. And it provides warmth to the baby also, and because of the smell of the breast milk, because of the smell of this thing, the baby starts latching. So all these signs in the delivery room, these are very, very important, which the parent should be aware of before they walk into the delivery room, so that this kind of care can be provided.
As you mentioned that breastfeeding should start just after the delivery.
In the first 6 months, the baby should be given only breast milk, nothing apart from breast milk. Only medications are the thing which can be given to the baby. So there is no role of any pre-lactal milk, and the baby should be offered the first feed as the breastfeed, and the first thick milk which is widely known as colostrum, that is very, very important to the baby, and it builds up the immunity of the baby, and there are many more benefits of this colostrum.
In urban settings, most of the deliveries are in hospital care. So we'll like to know what all care is done at the hospital, what all tests, investigation should be covered while the baby is out there in hospital care.
When the parents understand that, okay, the mother and baby should be together, once they walk from the delivery room area to the room, in the room, again, the parent should, first focus in the first 48 hours should be on the breastfeeding. And how the mother can establish the successful breastfeeding is not separating the baby from her. So the baby should not be lying in the cradle. Baby should be kept next to the mother. And whenever the baby cries or whenever the baby demands, baby should be offered the breastfeeding. The mother should be knowing that what are the techniques of successful establishment of successful breastfeeding or the latching. Second is keeping the baby in the comfortable environment. The temperature of the room should be adequate, and there is no harm in switching on the air condition. The temperature should be kept around 25 to 26 degrees Celsius. Third is that keeping few signs like, okay, in the first 24 hours the baby should pee. In the first 48 hours, in the first 24 hours the baby should also poop also, and in the first 48 hours the baby should at least pee. And then after 48 hours, the pee count will tell the mother or the parents that, okay, how adequate or how less adequate the breastfeeding is. So these are the few things which the parents should take care. And then before discharge from the hospital, there are few tests which are very, very important. Like over the years, it has been seen that the hypothyroidism, in which the thyroid hormone is deficient, this is the one of the very important cause of mental retardation. So normally, if a child is having hypothyroidism, this problem will manifest very much late. If we do screening means we subject all the babies to this thyroid test, and we pick up that, okay, these are the babies in which the hormone levels are lesser. We can start the treatment and we can prevent this illness. So this is called the TSH screening, and this should be done all across all the deliveries. Similar is the hearing screening, because the newborn can't let the parents that he can't hear. So every newborn should be subjected to the hearing screening before discharge or in the first follow-up visit, so that if we find a fault in that hearing screening test, before the 3 months, we can pick up, okay, that this baby is having hearing loss, and at the timely intervention can be provided, and that can prevent the speech delay also. So these are the few of the things, including the test, which in the first 48-72 hours before discharge from the hospital, the parent should be aware of.
So many topics you have touched in this, starting from lactation, the test, the speech delay. I'll pick them across in our discussion one by one. But going ahead, so you are saying that if we can test the TSH timely, we can prevent the mental retardation, which may at the end may be irreversible?
Yeah.
So once with that happiness and all, whenever that parents with their families, they are back with that child at home, that is the time when anxiousness strikes. So if you can just put some light over how to take care of a baby at home and in initial days, as you spoke earlier also about umbilical cord, we'd like to know your guidelines out there also. So please, if you can talk about that.
So when the baby comes back home, now the parents, they are being stuffed with so many advices, mainly from the grandparents, from the sister-in-law, from the peer friends, and there is always a peer pressure. So important thing will be that focus on these three things, that, okay, feeding the baby appropriately, keeping the baby warm, making sure that the baby is passing adequate urine. At the same go, the parent should understand that, okay, these are the worrying sign, or these are the signs that my baby is not doing well, and I should take the baby to the physician or the pediatrician, whosoever is in charge. So these signs can be if the baby is not feeding well, if the mother feels that the baby is lethargic, that means baby is not so active. If the mother feels that baby is having breathing difficulty or feeding difficulty, or baby is not passing urine well, or there are some abnormal movements, or sometime if the baby is appearing too much yellow. So, so this is the time when parents need to understand that little bit of yellowishness is okay, and yellowishness or jaundice is something which happens in majority of the baby, 70 to 80% of the baby. But that doesn't translate that all these babies will need treatment. Only 15 to 20% of these babies will need treatment. Vigilance is the main key, and the doctor will obviously advise the parents that okay, you come after 48 hours, and then so that he can scrutinize that he's the kid who needs treatment, and these are the kids who don't need treatment. So these are the few warning signs which the parent should be knowing and focusing on the main advice of feeding the baby and keeping the baby warm.
Just in the interest of viewers, I like to talk about a few practices also, like massage, removal of unwanted hairs. So, if you can put some light, what all is required, what is detrimental, what should be done, and what should not be done, specifically on these things like massage and removal of hairs.
So I think these are, again, the parents are very much curious. Some people will say that okay, give the bath on the day one. Some people will say no, 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 this will make the baby cold. You delay it for 2 weeks. So basically, there are no as such hard and fast guidelines. But we always tell the parents that in the first week, the sponging or a good sponging is equivalent to the bath, and our focus should be on establishment of the feed. The moment when the cord falls off, we say that okay, you can start oil massage as well as you can start the daily bathing the baby. And obviously, if in winter months when the temperature is too cold, they can either postpone the bathing little bit more, or they can do it once in the alternate days. So these are regarding the bathing and the massage advice. For the umbilical cord, nothing should be applied on the cord. There is a very bad practice, or in which, like in villages, etc., where the parents they apply cow dung on the cord. So nothing should at all be applied. And once the cord gets dried and shriveled and it sheds off automatically, then if some blood is present, it can be wiped off with the alcohol swab. So these are the few points which the parents should keep in mind when they are taking care of the baby at home.
So, it's all about feeding at the right time, keeping the right temperature, and observing for whether they're passing urine and poop at the times. Just one more practice about that, putting kajal in the eyes, if you can, and that swaddling of the where they wrap the kids tightly, if you can talk about that.
So these are again very very common things. Like the parents will ask, "Oh, we have this homemade kajal, and this is very pure. This is a very pure quality. Can we put that?" So it has been seen that if from whatever thing you will put the kajal, it increases the risk of eye infection in the baby, and it doesn't offer any added advantage of putting the kajal. So this practice should be condemned, and it should not be there. And like in Indian culture, they say that people will see and mere baby ko nazar lag jayegi. So if that is the case, then it can be done. It can be put, the like black mark can be put on the neck or somewhere else. But eye is such a sensitive thing that nothing should be applied there. If we go back in the era, so when there was no, when the means of maintaining or controlling the temperature were not there, and the hypothermia means when the baby's temperature decreased, that was one of the commonest reason why the babies were dying. Those were the time when tight swaddling were done, and that was mainly to keep the baby warm. But unfortunately, the practice of swaddling is in which the arms they are stretched and they are being tied very tightly. So let the baby be very comfortable in this world, and it's not a punishment that he has come. So let him be very very cool, very calm, and let him enjoy the life. Let him move his hands, move his feet. So the swaddling is it doesn't offer any advantage. Sometimes if the parents are too much hellbound that they have to swaddle, then it should be loose, and the arms should not be extended. They should not be stretched.
Great to know the way you are day in and day out. You are dealing with those myths. So, and I can see that neonatologist neonatologists can feel the pain of the kid. You talked about jaundice. I'll just like to go deep into it because it's so common and we face it day in and day out as doctors. And there are myths around it, that what should be worn at the time of jaundice, yellow clothing, etc. And then there are people talk about mother's milk causing jaundice, although I do understand that there are types of jaundice which affects. But if you can share what is to be followed in jaundice bit in deep.
So, jaundice is something when the parents come to us, apart from the thing that my baby is jaundice, they have so many paraphernalia of questions like the grandmother will say that because the kid's mother has eaten yellow things, is it because of that? Is the baby wearing yellow cloth? Is it because of that? So, jaundice is not because of that. It's very important for the parents to know that it is mainly because of the immaturity of the liver, right? And the jaundice starts usually after 24 hours of life. It peaks around 5 days and then it disappears around 10 days. In only 15-20% of the cases it shoots more and then it needs treatment, and the treatment is quite specific. There is no drug which comes. It's the phototherapy or blue light which we give. So, for mother feeding or mother eating habits, that doesn't translate into increased risk of jaundice.
What is important is that we should know that jaundice, what we see in neonates or newborn, is something which is very much physiological. It is not something which is related to infection, and infection coming from mother, etc. It does not require any specific treatment. It is more about giving the right support, and there are warning signs and the levels at which doctor will start acting. And we all know that phototherapy is something which is given. There are some gender specific things also in terms of neonate, like breast engorgement, vaginal discharge, vaginal bleeding, which are seen in specifically for a female child. So if you can just elaborate over there.
Yeah, I think the parents should know that there are some things which are very common. Like in a baby girl, the vaginal discharge is common, a little bit of vaginal bleeding is common. This is mainly because of the withdrawal of the hormones which she has acquired from the mom. And sometimes, many times, we see that the babies they have breast enlargement, and a common practice, age old practice, is that they press the breast and they express the milk. So this practice should not be done, because sometimes we do see that the kids come us with the, like, beneath the skin is a soft tissue infection which is cellulitis, and it eventually turns into abscess, and the baby needs drainage, and there is a scar which remains throughout the life. So normally it has been seen that the milk expression should not be done, and roughly in 4 to 8 weeks time the breast they will come to the normal size.
What all babies carrying with mother is having some effects. Going forward, since you were discussing about breastfeeding earlier, also, I'll like to pick up the topic of lactation and supplementation of formula milk over here. This is something a very common query that I feel my milk is not coming properly. So, what is the right quantity that we look for? Ki this is right quantity of breast milk. How do you define that? And when we should think about supplementation?
I think a very, very relevant thing, because when we embark that breastfeeding is the best, it's not that 100% of the mothers will have sufficient milk. And sometimes the mothers are very anxious. They don't know whether their milk is sufficient for the baby or not. So for a mother, there are few signs which she can think of, that whether they will point towards whether the milk is sufficient or not. Like one of that is, after second third day, when the milk production is good, she will start feeling that the breasts are full. And if the baby is latching properly, after the breastfeeding, she will feel lightness in the breast. And this is one of a very important sign.
And should be done with both breasts.
Yeah, and should be done with the both breast. On average, we say that a term healthy baby will take 5 to 10 minutes to empty one breast. So 10 minutes each side breastfeeding is sufficient. Sometimes the mothers, they keep on, the baby is latching for hours, and then they say that, oh, when we delatch the baby, then again the baby is hungry. So that means the baby is not drinking milk. There is some problem with the latching. So this is one of the signs. Second is how many times the baby is passing urine. Third is on the follow-up visit when they are going to doctor, what is happening to the weight of the baby. Again, it's very important for the parents to understand that all babies, they lose weight in the initial few days, and then they regain the birth weight by 7 to 10 days, and then they gain almost approximately 200 grams every week. So if the baby is following this weight pattern, so that means the milk consumption is sufficient. So these are the few points which the mother should take care when she is having questions about that, whether the milk is sufficient or milk is not sufficient.
And just anecdotally, I've heard in my house itself that cow's milk is great. It is something with which we were raised. So your views on cow's milk?
So this is something which happens because the grandparent, they always say that, oh, now the you are saying that this should not be given, but they see we have raised you with the cow's milk and you are so intelligent, you are a doctor, you are a lawyer, and this and that. So I think normally what I tell them is that science has advanced. It's not that 30 years back what we think that this is right only. So cow's milk is good, but the nature has made cow's milk for cow's baby. So for human baby, human milk is the best. Now, if the human milk is not sufficient, then the manufacturers, they have simulated the formula milk to the human milk composition. Although the formula milk is derived from the bovine milk only, from the cow or buffalo milk, but the composition of that is being simulated to the mother's milk. So if at some stage we feel or the mother feel that the my mother's milk is not sufficient, then there is a place for formula milk, not for the cow's milk, at least for the first year of life.
Formula milk is something which is medically curated to supplement the growing child's need. Got it. And any advice on food? There are a lot of myths around that also, that if you eat particular type of food that will spoil your milk, etc. So what should be? I do understand that balanced diet is the key, but any guidelines which you like to state, like there are sayings that you should eat a lot of ghee that will help you lactate properly. So something food guidelines for mother.
So I think normally the advice what we give to the mother is that she should be eating a healthy thing. B, she should not be eating the outside food like chaat pakodi, etc. It may not hamper the milk production, but it will make her sick, and then she will not be able to breastfeed the child. The third is good protein content is something which improves the quality of the breast milk, because eventually when we talk about the health of the baby, it's a good protein content. And in Indian women, we do see, because we are vegetarians also, the protein content of the human milk in Indian population, it's not so great. There are studies to suggest that. Fourth is drinking a lot of fluid. Lot of fluid is very much essential to enhance the milk production. So if suppose some lady is not having sufficient milk, we tell her that she should be consuming appropriate amount of the fluid. So these are the few things. Excessive amount of fat, the science doesn't support that.
It's the protein which plays the major role. Yeah, got it. One more thing, during the lactation, at times there are queries that if we are doing some social drinking, we are taking some alcohol, can it affect the baby? What should we do if he have taken the alcohol? So if anything you can suggest. I do understand that taking any amount of alcohol can be bad for a person, but just on the lactation side, on social drinking.
So there are two aspects for it. One aspect is that if the mother, she has the habit of consuming the alcohol daily, so that should not be done. Although there are studies which suggest that okay, 30 ml is doesn't harm the child, but we don't advocate that. The second aspect is the social or occasional drinking, like she is lactating and she is now 1 month or 2 months into lactation, there is a get together and she has to consume alcohol. So then also we suggest her to consume alcohol in moderation. And another key which we say is that before the consuming the alcohol, she should breastfeed the baby, and then maybe after consuming the alcohol, 3 hours later she doesn't need to breastfeed, and maybe she can express the milk and she can throw that out, and then maybe after 5-6 hours when the effect of the alcohol has gone, then she can again start the breastfeeding.
They should wait that body can clear out the alcohol and that does not get secreted in the milk. Got it, got it. As we are discussing right now about a healthy baby coming healthy from the delivery room and then getting discharged, we all know that premature baby is something which is a reality, and medical science has really progressed, and you specialize out there. Uh, a mature baby is one which is born after 37 weeks of gestation, and now medical science is to that level that NICUs take out even the 26-weeker healthy outside the hospital and spending healthy life. So anything which you feel that should be known to our viewers and listeners on if you are what you should do while preparing for a premature baby, and what all patience and journey of a parents with premature baby?
So I think with the increasing, like the science has grown and the things have grown, neonatology as such as a part has grown too much in the last 40 years. And even in India, if I go back and the time when I was doing my post graduation, at that time, even a 1 kilo baby, it was difficult for us to
Yeah,
make the
yeah.
baby survive. And now the time has come when 400, 500 grammer or 25, 26 weekers, they are going home with a good percentage, like 70, 80% of them are going home. However, prematurity, it's an added burden to the society. So in the antenatal period, whatever things like the if it can be avoided, that is the best.
Yeah.
So there are, if the mother is having few illnesses, it increases the risk of prematurity. So she should take care of her illnesses. The moment she feels that her sugars are getting out of control or her blood pressure is getting out of control, she should consult the doctor, and by this she can prevent that. Sometimes it's inevitable.
Yeah, well, basically, good antenatal care is a very, very important part of avoiding prematurity.
Yeah. And sometimes if it's inevitable, then the parent should know that antenatal steroids, corticosteroids, they are some drugs which may improve the survival of the baby and which may decrease the breathing difficulty and other morbidities or other diseases in the premature.
Very important that they should follow their obstetrician, take those drugs before premature delivery.
And even when the child is in NICU, then also the parents, they have a very key important role to play in the journey of a premature baby, because premature babies, they stay inside the neonatal intensive care unit for many weeks, 6 weeks, 7 weeks, 8 weeks. The parents are very much anxious. Again, the importance of breast milk here is enormous. The breast milk, the mother's own milk, can decrease the risk of a devastating illness, which is necrotizing enterocolitis, in which the intestine, they get necrosed, and that's a common illness in the premature babies. So the human mother's own milk decreases this risk by sixfold. So if the mother starts expressing her milk from day 1 or day 2, we try to give that milk to the baby, but sometimes the baby is sick and we can't give it. Then also, if she keeps on storing the milk at the proper temperature on the advice of the doctor, then when the baby is medically appropriate, then that milk serves as a very important thing which can change the outlook of the baby. Second is involvement in the care of the baby. Once the baby is stable, once the baby is out of the tubes, like out of the ventilator, etc., there are few very low cost interventions which the mother can do. She can spend time with the baby. There is a care which is called kangaroo mother care, where the mother keeps baby between the two breasts, and overall she wears a gown.
So this is done in your NICU itself. That mother comes over there, and kangaroo care is done for a few hours.
So this is done next to the bed of the baby, and the baby is under the oxygen monitor, and she is doing the kangaroo mother care. So this is called the family centered care, and this is the concept which has evolved, and this is one intervention which normally we say that developing world has given to the developed world.
Ultimately, nature has cure for everything, so I can understand how breast milk is so important. Even in a premature thing, it is far more important. Got it. Uh, Going forward, the excellence of medical science at NICU, there is another excellence of medical science, that is immunization. So that is something which starts, say, immediately after birth and goes till 5 years. And now we can talk about adult vaccination also. So there are some which are prescribed by government coming under universal immunization protocol. Then there are few added vaccines. So if you can just elaborate on how good and important vaccination is, and why there is a difference between universal immunization protocol and the protocol of Indian Academy of Pediatrics.
So I think there is a very old saying that prevention is better than cure.
Yes.
So vaccines are for preventing the illness. So they are for, so that when the baby is exposed to that bacteria or that virus, he or she already have sufficient antibodies that he can fight with that exposure of that bacteria or virus. So universal immunization program is the program which is done by the government of India, and that is for the all the well-beings. So the diseases which do have a sufficient load on the community, so the government tries to cover those diseases at the first go. So that is covered there. Then there are certain diseases in which they also have a load, but the load is not too huge that the government doesn't want to spend money. However, if some person or the parents they can spend money from their pocket, so they are also important. So that is why the recommending bodies like in India, the Indian Academy of Pediatrics, they have a different vaccination schedule in which approximately 7, 8 or 10 vaccination apart from the UIP program, they are being covered. And then the parents are being told there's although these are the optional vaccine, but this is the benefit of this vaccine. And then if they can afford, they normally goes for that vaccine.
We have seen patients of tetanus and all collapsing, and practically we feel so helpless at that time. If vaccination is there, then we can prevent those deadly illnesses. Coming back to the parent side, there are milestones which are observed, and we see to it what all milestones come at time. Most a very important milestone which we talk about is speech, and in present world we are observing that speech delay is far more common. If I talk about my own self, there was a speech delay in my child, also in my younger child. So why this is getting more common, or is it just that we are observing it more? Just want to understand your part.
So I think there are both the points are right. So one is that it is getting more common. Why it is getting more common? We are nuclear families now. The both the husband and wife, they have their professional life. They come back tired. They don't spend time with the baby. And this thing, the smartphones, they have actually, this is the disaster which they are bringing, because they are indulged in this smartphone business or the social media business, and then the kid also, he likes and he spend time in this
Yeah,
smartphone.
now Baba Black Sheep is from the phone or the TV, not from
Yeah.
the mother's lullaby.
I think this is, and the second is the recognition. The recognition also has now improved because this field of developmental pediatrics, it has been emerged in a big way. But there are few things like that. Suppose because the speech delay is so much, it's mainly the comprehension which is very important. So the first duty of the parent is to make the kid understand the things. So that's why they have to spend time with the kid, and the screen time should be zero. Less than 2 years, the baby should not be exposed to any of the screen time apart from if he has to do a video call, like to some distant relative or something like that.
So it's not the eyes, it's the brain which is being affected by this too much of exposure. Going to these milestones, as right now awareness is increasing, people are talking of an autism, which I do understand that it's a broad spectrum. But if you can just put some light, what are the warning signs?
Speech delay is one of the sign of autism. So sometimes the parents may feel that, oh, my baby is not indulging so much. There is a very poor eye to eye contact. The baby is living in his own world, right? He's all the time he's playing with the phone, and the parents feel that, oh, he's very intelligent. He picks this app up. But that's not a very good sign. So if the baby is living in his own world, there is a poor eye to eye contact, there is a speech delay, and there is the kid keeps the things in a particular order, like lined up the things or something like that. So these are the signs. Or he is frightened to sudden loud noises or sudden the loud lights, bright lights. So then these are the signs that when the parent should consult to a developmental pediatrician or first their physician, so that at appropriate time or adequate and timely interventions can be done.
So, Dr. Naveen, you are talking of lactation and latching. We do understand that newborns at times they always like to have get latched to their mother even when they are not hungry. So, usage of pacifier is something which is being used. Uh, is it medically fine to use a pacifier?
As far as possible, the usage of pacifier should be avoided.
Okay.
Excessive use of pacifier can affect the dentition.
Okay.
Right, it can lead to problems with the dentition. And so sometimes what happens is that the child is crying incessantly, and I mean, it's an inconsolable cry, and the mother sometimes needs relief. So for short durations it can be given. Although normally when we advocate breastfeeding, we say that whenever the child cries, put the baby to breast. If the baby is
Okay.
hungry, the baby will drink milk. If the baby is not hungry, he will use breast nipple as a pacifier.
And what about teethers?
So
Because there are
teethers,
dentition pains also.
yeah. So teethers are mainly used when the baby is having when the gums are being
Yeah,
gums are
yeah, yeah.
swollen, and the baby is in the process of teething.
Yeah.
So at that time, Many people use the gel or many people use medicines, but teethers are the one thing which can be advocated.
Okay.
The important caution here is that if the teethers they are first put in the fridge, then they will actually soothe the pain more.
Yeah, that cold
So
thing will help.
yeah, and sometime if the baby is younger, then the wider teethers, the teethers which are quite wide, they will not come. So there are now new teethers like which comes in the form of a pen or etc., which the child can be offered.
Got it. As you talk about incessant pain, we know that many babies go get a pain which is said it is a colic, and there are different medications, oblique home therapies for that. So, if you can enlighten out there on colic.
I think it's a very interesting thing and something which almost every child has to go through. It's a spectrum. So some babies will have very minimal colic, and some babies they have like such a severe colic that they will make the life of the parents hell. So the parents they get too much anxious. So we counsel the parents like this, that it is something which is episodic, which will come and go. It starts normally after third, fourth week. It remains till 8 to 10 or 8 to 12 weeks. And there are medications, although there is no magic bullet for it, but the medications are given for the temporary relief. But similarly, apart from the medication, the non-medication things like patting the baby on the back, taking the baby out, playing light music, taking the baby out in the car. So something like this, diverting the attention of the baby, that also
Different
play a
things
role.
clicks with different babies.
Yeah.
Yeah. So yes, an important investigation, a simple but a very important investigation of TSH, which can tell us about something which is deficient and can lead to a poor brain growth and hence a mental retardation, which is an irreversible condition at this age. As I do understand that there are other tests also, and this TSH is also done from a heel prick, so it's not something that we are going to prick a baby and take that blood. So if you can talk more about the diagnostics test for inborn error of metabolism, and just tell our viewers what is the spectrum of disease for which developed countries screen regularly, and there are few hospitals and institutions in India also who go for investigations for inborn error of metabolism.
So, inborn error of metabolism is a group of illnesses in which there is a defect at certain step in the digestion of the things. Like we eat food, food consists of proteins, fats, carbohydrates, and they are being digested to the molecular level or to the elementary level. And there is some defect and some enzyme is missing, because of which there are some important things which are lacking, which are needed for the function of the various organs of the body. So the baby may manifest like simple things like vomitings, like lethargy, or baby may have fits. So sometimes these are the signs which mimic other illnesses, but it's very important to rule them out. If we screen for these inborn error of metabolism, which the developed world is doing, so if we pick them up early before they manifest, then we have specialized formulas, and we can give the baby that formula which is devoid of that substance which the baby is not able to digest.
Got it. So we'll supplement what that body is unable to make, and that will help in a proper development of the baby, and hence those that damage and that illness will not manifest.
Can be avoided. Basically, although these are very important things, but in India, maybe this is not the priority. So that is why it's not being routinely practiced. Although there are certain hospitals or certain sectors in which the parents are given an option, and if they want to opt for these tests, they can go for this test.
Yeah.
Just sometimes, so for this test, we have to screen for 56 disorders.
Okay.
And if the parents don't go for that test, like the place where I am working, we do screen them for 7 disorders, which are more modestly prevalent in the country.
Yeah.
So many units they screen the newborns for these 7 disorders. So inborn error of metabolism is something which we don't know. Maybe 10 years down the line in India also it will be practices at a very
So
high
yes,
level.
it's a rare disease, but if an aware patient feels
It's
that
important.
they can, they should. Yeah. So it's more of a cost versus taking a decision on whether we have to do it or not, rather than just another test.
Yeah.
Really enlightening to know so much about neonatology and infant. I think we can go for this discussion for long, but really grateful for the insights. Thank you, Dr. Naveen.
Thank you. Thank you, Prashant and the Tata 1MG team for calling me.
Thank you.
Thank you. It was a pleasure.
Thanks, viewers and listeners. I hope this session was insightful and will help you to take care of your newborn and infants and will allay the anxieties in the upbringing. So stay healthy, stay wise till we at Tata MG bring care to health.